What exactly is frontotemporal dementia? Hi there, I'm Dr. Jim Collins, and I would like to give you a brief introduction to frontotemporal dementia, or as we abbreviate it, FTD. Frontotemporal dementia is gaining more and more attention these days as a more prominent form of cognitive impairment among older adults and seniors. What's interesting about it is it's not a single disorder, but actually a group of disorders that are caused by the progressive loss of nerve cells in the frontal lobes of the brain, and is sometimes referred to as frontotemporal lobar degeneration. So let's talk about proteins. The proteins that are involved in FTD. Any type of neurodegenerative disorder involves proteins. So damage in this area of the brain is associated with a number of problems, including deterioration in behavior, personality, and producing in or comprehending language. A number of different diseases cause FTD, but the two most prominent are a group of brain disorders involving the tau protein, T-A-U, tau protein, and a group involving the protein TDP-43. Let's talk about Pick's disease. Do you remember that term? No one's exactly sure, okay? But these two groups of brain disorders attack the frontal and temporal lobes of the brain, leading to cognitive impairment and dementia. FTD, frontotemporal disorder or dementia, that's what we call it today. It used to be called Pick's disease after the physician Arnold Pick, MD, Dr. Pick, who first described the symptoms, believe it or not, in 1892, a long time ago. Here are two main types of FTD. There is the behavior variant frontotemporal dementia, which is characterized by prominent changes in personality and behavior. It usually occurs in a person's 50s or 60s, but can occur in an individual as early as their 20s and as late as their 80s. Okay? Nerve cell loss takes place in brain regions responsible for controlling conduct, judgment, empathy, and foresight. Now, the other main type of FTD is primary progressive aphasia. This affects language skills, speaking, writing, and comprehension. It usually occurs right around the age of 65, but can occur later in life, generally not earlier in life, and that is one of the differences between the two. Frontotemporal dementia also includes disturbance of motor function from the following three disorders: ALS, amyotrophic lateral sclerosis; corticobasal syndrome, which is the discoordination or uncoordination of arms and legs; progressive supranuclear palsy, which involves muscle stiffness, difficulty walking, changing in posture, and affected eye movements. Now, what are the causes of frontotemporal dementia? According to experts, 33% of cases are inherited, making genetics a big risk factor. Other than that, there are no known causes or risk factors. That's it, genetics. Although much research is needed to determine what, other than heredity, might cause this disorder, heredity seems to put people at an increased risk of developing it later in life. Not early in life, later, 65 plus. Treatment. It's sad for me to say, as a gerontologist, unfortunately at this time, there are no specific treatments, no specific medications whatsoever for frontotemporal dementia or those related disorders that I talked about. Psychiatric meds might help with certain symptoms like depression, anxiety, agitation. Any treatments provided are meant to do two things: manage symptoms and improve the individual's quality of life. The person at one point during these diseases may require ambulatory assistance from devices like walkers and wheelchairs because movement disorders will only become worse later. My final thoughts. Much is still unknown about frontotemporal dementia, like the causes and the risk factors. Regrettably, there are no known preventions, no treatments, or medications for the illnesses that develop due to FTD. The answers may lie within the proteins that are involved, and only time will tell with this disorder, frontotemporal dementia. Thanks for tuning in. Come back for more information. Email me sometime, jim@collinslearning.com. I'd love to hear from you. Take care.